Welcome. My name is David Williams, and I'm the chair of the Department of Social and Behavioral Sciences and the Florence and Laura Norman Professor of Public Health here at the Harvard Chan School of Public Health. Today, I am delighted to be here with Professor Daniel Dawes. Daniel is a healthcare attorney and equity advocate working to reduce health disparities via legislative reform. He serves currently as the Senior Vice President of Global Health and the founding Dean and Professor at the School of Global Health at Meharry Medical College. He's also the author of the influential book, The Political Determinants of Health, which introduces a new way to think about the forces behind racial and socioeconomic health disparities. So, Daniel, let's start at the very beginning. What are the political determinants of health, and how are they related to what we talk about much more often, the social determinants of health?
That is a great question, and I am so honored to join you this morning to have this discussion. You know, it's really building upon the work that you have led along with other scholars, looking at the social determinants of health, right? We've talked about the structural conditions in which all of us are born into, we live in, and eventually die in. And I remember having a discussion with David Satcher, Dr. Satcher, who served on the World Health Organization's Commission on the Social Determinants of Health. And I said, you know, I feel like this has been groundbreaking. This is eye-opening about these forces that impact, disproportionately impact, play an outsized role in our overall health and well-being. But there's something for me that's missing. And there is that connection between the social determinants of health and their policy roots, the policy actions and inactions that have led to the structural conditions in which all of us find ourselves in. And so I argue that those really are the fundamental instigators or the causes of these social determinants of health that have had an outsized impact on the health and well-being of communities. So for me, it's so important as we're thinking and talking about political determinants of health to look at them in different buckets. I look at them, I start from I start with the end, with looking at policies, right, and dissecting how those, from a legal epidemiology framework, how have they impacted certain groups. I look at government, I look at the processes and the rules and whatnot to see how have that limited our ability to introduce, right, and pass these policies that would be more equitable. That has been quite an interesting process to figure out what has worked, what hasn't, what is salvageable, what else do we need to do to bolster then and you know, basically go back and reintroduce those that have been gone in this environment. So that is what I've been focusing on in terms of ACA. I've also been looking at policies dealing with DEI at the state levels. If you follow state law, you know, the backlash in Tennessee where I live, we've had no shortage again of bills being introduced in the legislature, and we have had to go into the state assembly to make the argument for why it is important from a health sciences standpoint to allow us to continue with this agenda. That it's not just about black folks. When we're talking about diversity, equity, inclusion, and belonging, we're talking about all population groups. People with disabilities, LGBTQ individuals, you know, veterans, older adults, et cetera.
I want to shift to talk about what you're working on now. You've been involved in the launch of the School of Global Health at Meharry Medical College, one of the historically black colleges and universities in the United States. And what you're proposing is the first of its kind at a historically black college university. Why is a global school of public health needed now? And why is Meharry Medical College the right home?
Now, why a School of Global Health? One of the things that we recognized is that there are so many amazing things, so many interesting research, so many ways of looking at health inequities around the world, and we haven't connected those. I recognized after National Academy of Medicine was asked by NIH to revisit the unequal treatment report, and they asked me to do an assessment, a study of interventions over the last 20 years. And as I worked with 29 scholars around the country, we were digging into the peer-reviewed journal articles and the social sciences and medicine, public health, you name it. And it was so sad for us. The majority of them, of course, had not utilized an equity lens, right, at least from what we read. And the majority of them were not successful in eliminating health disparities. And the majority of them focused on at the individual level, right, that downstream level instead of at the structural level. And as we were looking at that, as we got through COVID-19 and recognized how difficult it was to mitigate the impact of COVID on communities of color and other vulnerable populations, people with disabilities and so forth, it just dawned on us that, you know what, if we're not going to do this, now we'll never get it done. We need to unite. We need to harness the power of transdisciplinary collaboration, multi-sectoral collaborations, to get at the root causes of these inequities in our society. And that is why we have now been working diligently to establish a school that will help leaders and scholars navigate political and economic structures as well as navigate societal structures, right? So they can be more effective as leaders in moving the needle of health equity in a degree that will be meaningful.